morning, dancers. So today we're going to be talking about popping or clicking hip. It's a sensation that us as dancers get a lot in class, and these are some of my tips and tricks that I did to overcome my hip pain. Now, why do we get this hip pain in the first place? It can be due to several different reasons that are causing that pain. So what are the underlying causes? Think for yourself, what are they for you? One is overuse. So when I mean overuse, you are sometimes overusing the wrong muscles and you're not using the proper muscles to be able to hold or extend your leg in the correct position. Another thing that happens is it comes from poor instruction. With that said, yes, you might have poor instruction, but you could also just not be listening to your teacher as well. So make sure that you are really paying attention in class and listening to your teachers. If you do have this pain, maybe go and talk to your teachers. Talk about, am I using the proper muscles? If I'm not, what can I do? What can I do to strengthen different muscles? Or is there someone that you know who can help me with this area so that I can perform? Sometimes we have teachers that push us beyond our abilities. We might have strengths and abilities, in terms of we have wonderful extension. We can actually even force ourselves to do the movement, but we might not actually be doing it correctly. For me, as a dancer, I would extend my leg to the side with a développé, but I wasn't using actually any of the proper muscles. I was actually using the smallest and tiniest muscles to extend my leg. It takes someone very skilled who can pinpoint for the dancer, no, you're actually using this muscle improperly, you need to use this muscle. I had a trigger point myofascial therapist who would actually grab certain muscles in motion, releasing different ones and forcing me to turn back on those proper muscles to be able to extend my leg. The other thing that can happen that is resulting from this popping or clicking sensation is that you have scoliosis. So I went to a doctor and he had me bend down, and when I was starting to come up, he noticed that there was like a ridge or a hump on one side of my back. And it was around that time when I started having hip problems that I actually realized that I had scoliosis. And that was a big contributor to my hip pain as well. If you have scoliosis, I do recommend that you get some sort of adjustment made. I'm going to try to make another video on scoliosis and some of the tips and tricks that I did for that as well. But for now, just think of what can I do to maybe level out my hips. Chiropractors can help. Sometimes trigger point myofascial therapist can help. Different people can help loosen those muscles or different muscles and get your hips in line a little bit more. And my hips were definitely unlevel, and that was causing some strain and muscle issues in my hips as a result. When the popping or clicking sensation happens, it's usually because there's a protrusion or a bone that is right here and the muscle is too tight and it's not gliding in the proper way and causing this friction that is happening. So the muscle or the tendon needs to be stretched out in a different way to help everything glide in a proper way. Whatever it might be, whatever your underlying cause is, trying to find someone or thinking about some of these tips and tricks that I'm going to share for you to try to relieve that pain and perform and dance more freely. So whatever your underlying cause is for your popping or clicking hip, you can think for yourself what it is. It might be something entirely different, but for me, these were some of the different things that I went through, and these are some of the things that I also found very effective and helpful at treating my hip pain. A quick story for you. When I was about 9 or 10, I started having hip pain. I ended up going in to see a doctor, and the doctor was like, we can give you an injection, and a lot of dancers we've seen need hip replacements later on in life. And for me, you know, as a young dancer, I was like, oh my goodness, this is crazy. Like, I don't want to have that happen, you know, years down from now. I could go for the injection, I could have gone down that route, but I chose to look for alternative ways to help with my hip pain. I ended up going and seeing a myofascial therapist. She did trigger point therapy. She really was able to isolate the different muscles for me. And so my first point for you is to go see a myofascial or trigger point therapist to see if they can dig into different places and help you release the tension or the muscle pain that you are experiencing. Okay, with that said, there is different things that you can do by yourself. This is a lacrosse ball, and I'm gonna show it like, I'm gonna show it sitting up, because this you're actually going to do laying down. But anyway, I'm showing it so that you can see where you should place the ball. If your belly button is here, your ball should be just a little bit to the side, and you place the ball here. Now that releases some of the tension that is built up in your abs or along the psoas as well. So if your hip bone is here, you don't want to go on the bone. Don't go on the bone, that hurts. But there's a muscle along here that gets pretty tight. So figuring out, you can really move around the ball in this area, general area, just don't go on any bones. And then around the hip bone as well, rolling and down. Not too far down, obviously, but rolling it up and around. And you can even lay on your side as well. The next point that I want to talk about is, if this is your thigh, this is like your thigh muscle, you can also put the ball like right here. So here's my hip, I'm trying to show you. And then you roll down, but mostly it's a little bit higher, but you can roll down as well. So those are all different muscles. And again, you just lay on your stomach and do this. And I actually recommend, when you're doing the thigh muscle, to bend your leg. So let's say it's here, you're placing it, and then you bend your leg, and you can even stretch and pull up as needed and move it around. But that's gonna release some of the tension that is caused there. Using a lacrosse ball is really wonderful. If it's too hard for you, go ahead and use a tennis ball. Sometimes that's a nice way to ease into things. And if that's even too tight, I recommend laying on a soft bed. And laying on a soft bed will really help just relaxing the muscles. You don't want it to be too hard, otherwise the muscle just like cramps up. You want it to be just enough so that the muscle relaxes a little bit and starts continuing to loosen, loosen, loosen. Sometimes we don't really have good strong cores, and then that causes other different muscles to not work right in our legs and causes hip pain and stuff like that. So you do need to work on your core strength, but with the core strength, sometimes some of those core exercises, they use the hip flexor muscles so much that it actually aggravates the pain that you're experiencing within your hip. So a lot of people recommend, oh, do like Pilates, or oh, do this, or oh, do that, where you're laying down and you're just doing all these ab muscles, but you're really flexing those hips so much that everything gets, you know, intensified. So when it gets intensified, I'm going to show you a basic stretch. You can do a nice hip flexor stretch. This is one, and then the next one is up and straight. And the last one, you can turn out. So knee faces out, knee faces down, knee straight up. And then pulling up or pulling up your hips from the front will give more of a stretch along here. So when I started getting hip pain, I actually started going to physical therapy, and they gave me strengthening exercises as well. You lay down, and there's 4 different ways to do this exercise, and you can build up slowly with the amount of weight on your foot, starting with half a pound and then going up to 2 or 3 pounds if you would like. Remember to hold in your core. Then we lift our leg up and down. Nice, slow, and controlled, holding in our core. And we do that 10 times. Then flip 10 times, lifting up. Then 10 times lifting up from the back, trying to hold in your core at the same time. And then lastly to the side. You do this exercise honestly 10 times, and then you do it 3 times through. Build up on your weight, don't take it too much too fast. The last point that I want to make with the lacrosse ball is if you have scoliosis, this is a great way to help relax different muscles from your back and maybe align your hips a little bit. So just think about all of the body. Where are you tight? How can you adjust and make things straighter if you can? And so this might not be like a point for you, and if so, you can skip over this. But for me, I really appreciated this, and this actually helps, funny enough, with digestion. When I do this, my stomach starts to like rumble and relax. So yeah, if you have problems with digestion, do this. So if this is your spine, you want to go all up and along your back with this lacrosse ball laying down. So you're laying with your knees up, and you're going to put the lacrosse ball there. Put your hands down to the side, and you can put your feet together, and then you just sway your legs back and forth, pushing down with your core as needed or as you feel is comfortable. And then you can move it down. Just again, don't put this on any bones. Now this part is a little bit tricky, and you're going to need to see someone specifically for this, but when I had my hip pain one of the times, there was a muscle actually in the inside of like my groin along here. She would grab it in such a way with my legs in a middle split, which I cannot do because there's not enough room. But she would grab it, and I would be bending my leg up and then stretch down, and then bend it up and then stretch down. And she really got in there and helped relieve some of the pain and tension that I was feeling. Work on your form. Okay, so this is really hard for dancers, for them to hear and for me to even apply myself. When you have an injury, particularly within the hip, you are going to need to lower your leg and concentrate more on your form and your core strength. So maybe it's only holding your leg up to 90 degrees. Maybe it's holding your leg up even lower at 45 degrees, but really working on your turnout. How can you work on your form? And trying to find actually a lower level class to go to with teachers who really just concentrate on some of the basics can help you isolate those muscles. Just think about not necessarily crazy combinations, but just working on your form, your core strength, your technique, and getting that stronger so that you can succeed better. Okay, so we know that ice decreases inflammation, and so if you are experiencing hip pain, you need to decrease that inflammation. So make sure that you are icing, especially after you've worked out or especially after class. All right, so supplements. Supplements can be helpful for decreasing your inflammation. Omega-3 fatty acids are really helpful for decreasing the inflammation in your hip. I take 2 every single day to help with inflammation. There are probably other supplements actually out there, but you can talk to your doctor or physical therapist, someone who is a healthcare provider, and ask them what they would recommend for supplements. Nutrition. When we get sick, we often think about, okay, how can I get better? Maybe cutting out sugars, unhealthy fats to help us get better. But even with injuries, we can do that as well. Cut out sugar. Sugar inflames the body by a lot. So cutting out sugar when you get injured can be helpful for you. Also getting rid of those unhealthy fats, making sure you have enough protein in your body to help build up those muscles again. For me as a dancer, later on in my life, I actually went to a nutritionist. I saw 2 different nutritionists to help me maximize my nutrition so that I could dance better. I realized that I actually wasn't getting enough protein in my diet, and so, they can look at your body mass and, all of these different things. I do recommend you see a nutritionist if you go further down the road to, your dance is, your career. Your nutritionist will be able to help maximize your dancing potential. Okay, so 4 different people that you can go see to help you with your hip injury is 1, a physical therapist. They can give you exercises and extra stretches. You might not go for a very long period of time, but they can just give them to you. Sometimes they even print you out slips of paper so that you can take them home. If you are actually very disciplined and do your exercises, then you don't have to keep on going back from week to week. Someone who does microcurrent. So for me, I also saw someone who did microcurrent, and they would put it on my hip, and sometimes one person actually had a whole glove for microcurrent, and she would grab in certain places and make me move. But anyway, someone who does microcurrent can also be able to help you with your injury in your hip. Microcurrent decreases inflammation. It helps promote healing, and it's sometimes like when you put it on, you feel little tingles, but overall it is very helpful for my hip pain, so it might be helpful for you as well. Do you have to work with someone who does microcurrent? There are certain times in my life where I have used microcurrent. It has caused a hormonal imbalance for a period of time. So make sure if you do see someone who does microcurrent to talk about with them, is this going to affect my hormones? If you are doing microcurrent and it is on you and you're experiencing more pain at that point in time, you definitely need to tell them and take it off, because that is probably the incorrect frequency for you. There was a period of time where I was running a certain microcurrent, and I ran it because the person told me to run it, and it actually caused further problems. So if you do not know, or if they did not know the correct frequency to run, again, every body is different. So sometimes it's a little bit of you got to figure it out with microcurrent, but microcurrent in general does help decrease the inflammation, decrease the swelling, whatever it might be that's in there, and help promote the healing. A massage or trigger point therapist. A massage or trigger point therapist can massage you out in different ways. I also went to someone who just did trigger point therapy for a while to help release different muscles in my body. Whoever massage or trigger point therapist, that's my next other person that I would say go to help relieve some of that pain. And lastly, a chiropractor. A chiropractor can crack you in different places, help those hips to adjust properly and even them out. I have gone to chiropractors as well and have experienced relief. So in particular, maybe if you have scoliosis, you might be able to see a chiropractor to level out your hips a little bit. You know, when you think about an injury, for me, when I'm in the midst of hardship and pain and suffering, I get really down. When you're experiencing the pain in the moment and you're feeling it, it just seems like you're never going to be able to get out. You can get out, you can get the relief that you are searching for. So search for help. It does take time, but you can find it. And I really do hope that some of these things help you get relief from your pain, but really do search out different methods of help. There's a lot out there, and but everybody is different. So I do feel for you. It's really painful, but you can experience relief. A note of encouragement for you today: when you pass through the waters, I will be with you. And when you go through the rivers, they will not overwhelm you. When you walk through the fire, you will not be scorched. The flames will not set you ablaze. For I am the Lord your God, the Holy One of Israel, your Savior. If you liked this video, give it a thumbs up and subscribe, and I'll see you back for more. Thanks for watching. Bye!